Have you heard of the female condom? Most people haven't, and that's exactly why we need to talk about it. The female condom, also known as the internal condom, is a barrier method of contraception designed to be worn inside the vagina during sexual intercourse. Unlike the male condom, which covers the penis, the female condom lines the vaginal canal and also partially covers the external genital area. It's usually made of nitrile, which means it's safe for people with latex allergies. Each female condom has two flexible rings. The inner ring helps with insertion and keeps the condom in place near the cervix, while the outer ring stays outside, covering part of the vulva. It prevents pregnancy by blocking sperm from entering the uterus, and it also offers protection against sexually transmitted infections, including HIV, gonorrhea, and chlamydia. One big advantage is control. The female condom can be inserted before sexual activity, and it allows the receptive partner to take charge of protection. It also doesn't require an erection to work and doesn't reduce sensation the way some people feel male condoms do. With perfect use, female condoms are about 95% effective at preventing pregnancy. With typical use, effectiveness is around 79%, which is why correct use is important. So, in summary, female condom is safe, effective, empowering, and under-discussed. Knowing about it gives you more choices, and in sexual health, choice matters. If you find this helpful, share it. Someone out there needs this information.